Before we begin, we have a few housekeeping items to review. Please know that this session is being recorded and your continued participation indicates consent to be recorded. We have also turned on closed captioning for this meeting for accessibility purposes. In order for you to receive the session evaluation and reminder and the follow-up materials that we're going to send, including the slides, please put your email address in the chat. We'll be sure that you get that follow-up material and you'll get the link again for the continuing education credits as well. So if you could put your email addresses in the chat at this time, that would be extremely helpful. You can type any questions you have in the chat box during the sessions, and we'll answer them throughout the presentation. Please use the everyone option when you're sending your question so that everyone gets the benefit of hearing what that is. At the end of the session today, we'll share a link in the chat box, which will direct you to the session evaluation. This is also how you will claim continuing education credits for this session. Next slide. So no members of our planning committee nor our presenters have any conflicts to disclose. This session is approved for 1.25 hours of continuing education credit. The information being presented today represents the views and opinions of the individual presenters and does not constitute the opinion of or endorsement by the UPMC Center for Continuing Education in the Health Sciences. There is a mutual agreement in place for all Peru webinars, including this Recovery Coach Workforce Education Series. We review these points every time, and I know for those of you who've been here before, it can be frustrating to go over this every time, but these points really are essential for a respectful learning environment. So we want to go through it together. So everyone on every Peru webinar is valued. Everyone has an expectation of mutual positive regard for everyone else that respects the diversity of everyone on the webinar. We operate from a strengths-based, empathetic, and supportive framework with the people we serve and with each other on these webinars. We encourage the use of affirming language that is not discriminatory or stigmatizing. We treat others as they would like to be treated and therefore avoid argumentative, disruptive, and/or aggressive language. We strive to listen to each person, avoid interrupting others, and seek to understand each other through these trainings as we work toward the highest quality services for all clients. Information that's presented in these sessions has been vetted. We recognize that people have different opinions, and those diverse perspectives are welcomed and valued. Questions should be framed as constructive feedback. This format is not conducive to debate. This includes religious and political comments that could cause debate. If something happens that concerns you, please send a chat during the session, the panelists, and we'll make room to address it either during the session or by scheduling time outside of the session to process and understand it. This session is presented in partnership with and funded by the Pennsylvania Department of Labor and Industry. So it is now my pleasure to introduce my colleague, Christine Kroll, who is an accomplished clinician, researcher, and implementation specialist who's dedicated to health equity and behavioral health integration. As an implementation specialist on our team, Christine bridges research and community-based interventions. She's a licensed professional counselor and a behavioral health consultant. She's integrated behavioral health and SUD screening into primary care. Her research focuses on chronic health conditions, mental health, and resilience. She's also a doctoral candidate in clinical psychology, specializing in health psychology. And Christine's presented nationally and internationally, and she's published on flourishing and family resilience. And she remains committed to evidence-based health policy and practice. So with nothing further, I hand you over to my very capable colleague, Christine.
Thank you, Julie. Hello, everyone, and welcome. Again, welcome to our third in a series of 5 sessions in the Recovery Coach Workforce Education Series. Today, we'll be talking about building partnerships and community integration. If you're just now joining us, remember to put your email address in the chat. I can see some of you already doing that, so that we can send you the follow-up session material. This training is designed to equip participants with the knowledge and skills needed to support individuals in recovery as they navigate vocational training and employment opportunities. By focusing on best practices in assessment, skill development, and client engagement, participants will learn to tailor their approaches to meet the unique needs of clients in recovery. Additionally, the training emphasizes effective strategies for connecting clients to job training and maintaining motivation, fostering sustained engagement with care management providers and employment services. These objectives aim to enhance your ability to facilitate meaningful progress and long-term success in recovery through vocational support. Since this is our third session in this series, I wanted to revisit some of the key points from our first two sessions as background for those who may have missed them. So the significance of employment in recovery for individuals with opioid use disorder, OUD, lies in the ability to provide critical elements that support long-term recovery, including structure, accountability, motivation, and alignment with the person's chosen recovery pathway. Employment offers a stable framework that helps individuals establish routines, fosters a sense of responsibility, and provides financial independence, all of which are essential in maintaining recovery. Moreover, having a job can strengthen a person's commitment to their recovery process by offering a sense of purpose and tangible rewards for progress. Employment interventions positively influence substance use treatment outcomes, with nearly all studies indicating a beneficial relationship. Employment serves as a protective factor against return to use, reinforcing the importance of integrating job-seeking support within social services programs. Employment-based contingencies, which tie job-related incentives or requirements to participation in treatment programs, have proven to be highly effective as a motivational strategy. These contingencies often involve linking continued employment, financial benefits, or workplace privileges to adherence to treatment. Some studies have reported a 100% enrollment rate when contingencies were added. Research has shown that participants who receive employment support not only adhere to treatment more consistently, but also demonstrate significantly better outcomes, including a 50% increase in recovery rates compared to control groups. Employment provides significant psychological benefits as well, especially for individuals in recovery from OUD. Achieving work-related goals boosts self-worth, as a sense of productivity and personal fulfillment restores confidence and pride in one's contributions. Employment fosters a sense of accomplishment, which is essential for rebuilding self-esteem during recovery. It also offers individuals a chance to develop a new sense of purpose, allowing them to redefine their identity based on their skills and their professional roles rather than their past substance use, helping them focus on their strengths and move forward with a renewed sense of self. Additionally, work challenges promote continuous learning and personal development, offering opportunities to overcome obstacles, build resilience, and strengthen coping skills, all of which are vital for sustaining long-term recovery. Employment thus serves as a platform for ongoing growth and development in recovery. Employment provides significant social benefits for individuals in recovery from OUD. It creates opportunities to build positive relationships and expand social networks beyond traditional recovery groups, reducing feelings of isolation and also helping to establish a broader support system, which is crucial for maintaining recovery. A positive workplace can offer emotional support, where colleagues reinforce recovery goals and provide encouragement, contributing to a sense of safety and community. Working alongside others fosters a sense of belonging, helping individuals feel connected and integrated to society. This connection is vital for mental health and recovery, as it encourages engagements with surroundings and pride in one's contributions. By establishing a social identity through work, individuals can strengthen their commitment to recovery and build a fulfilling life. So strategies for connecting clients in substance use recovery to employment services focus on creating pathways that support their transition to stable employment while addressing the unique challenges they may face in the recovery process. So we would like to hear from you all today. There are some built-in questions throughout the presentation, and that's what we'll use to do that. If you have any questions or comments as we go along, feel free to raise your hand or put a comment in the chat. So here's our first question. So raise your hand or put a question in the chat, and we'll see if we can unmute you and hear from you. What are some strategies that you use to connect clients to employment services? What are you already doing to connect folks? And you can feel free to raise your hand and I can unmute you, or you can put your answer in the chat. So I see in the chat, some folks are interviewing them to determine their interests. Indeed, which is perfect. The use of a job matcher program. Yep, a lot of job matching. And I think I saw a hand raised, but it went
I think
away.
that may have been an error, Christine.
Okay.
Down.
I got excited. I was like, yes, raise your hand. We'd love to hear from you. All right. So going back to the chat, I see job matcher, CWDS assessment. I'd love to hear more about the CWS assessment. Outreach to find clients where they are. Referring to job matcher services, temp agencies info. Helping them write resumes and helping them post it online. That's definitely an important second step. Yep. OVR Career Link, specifically utilize community resources. PA Career Link, provide specific workshops for those in recovery. Community outreach, job matchers, providing clients with information regarding job fairs, providing a list of employers who are involved in second chance hiring. Indeed, Monster, Career Builder, a recovery-friendly workforce. Teaching them to utilize LinkedIn, yes, and LinkedIn's filter tools. Connecting clients to workshops and WIOA. Encouraging them to visit local businesses to inquire about job opportunities. Yeah. So going through the intake process to discuss their situation and then develop positive working relationships, identifying what their career interest is, educating employers on how to read a background, making sure the customer starts with it didn't finish, I think it didn't finish out, provide a list of resources, recognizing barriers to employment and helping them overcome them, providing interview clothing, referring clients to workshops to learn how to navigate PA CareerLink's employment portal, and to learn how to seek and apply for employment through their account, making sure the customer completes their welcome class. Thank you, Sharon. One-on-one assistance with online application, almost like tech assistance in the Career Resource Center. Perfect. Making sure I didn't miss any raised hands. Okay. All right. Thank you guys so much. So we have some great things in the chat. It seems like you guys are already doing that work and doing those strategies. Yes. PA Career Link here in PA South Central is working to help people with reentry. All right. The first strategy in supporting individuals in SUD recovery as they transition to employment is determining which services will be most effective for their specific needs. Identifying barriers to employment is a critical step, as individuals may face challenges such as criminal records, gaps in work history, stigma, a lack of transportation, or the need for workplace accommodations. A comprehensive assessment, as some of you guys have mentioned, can help determine which interventions will be most beneficial. We talked at length about this in our last session. One study identified 5 key services that significantly enhance the probability of successful employment for individuals with SUD. The first is job search assistance. This includes guiding individuals through the job search process, helping them develop resumes, prepare for interviews, and find employment opportunities that align their skills and experience and recovery needs. So some of you guys mentioned that that's exactly what you're doing. Job placement. So matching individuals with suitable job opportunities that fit their skill sets and personal circumstances is essential. Support in this area may include connecting with recovery-friendly employers or those offering that you guys on the ball and you are already aware and are already doing. Need continued assistance to navigate workplace challenges. This
Christine, you're breaking
development,
slightly for us. Maybe if you turn off your camera, it'll save bandwidth.
I'm sorry, Julie, did you say something?
Yeah, you're breaking up slightly for us. If you turn off your camera, it may save bandwidth for your voice to come through. Just a
I see.
suggestion.
All right, just give me 1 second to turn my camera off. Thank you, Julie. All right. Oh, yes, and someone put in the chat that it's freezing. Thank you. Okay. All right, hopefully this helps. So I was going through the different services that might need like 5 key services that could significantly enhance the probability of successful employment. So I went through job search assistant, job placement assistant, and then I was speaking to on the job employment is a key factor in long-term recovery and stability. Ongoing support may include career counseling, return to use prevention strategies, and assistance with workplace conflicts or job advancement. And then in the other support services category, these are services that could address many of the barriers you identified through an assessment. Additional services might include things such as transportation assistance, childcare, legal support, or financial counseling. They can significantly impact an individual's ability to maintain employment. These wraparound services ensure that external barriers do not impede job success. I know these assessments may be too small to see here, but you'll receive these slides afterwards, and so you'll have the active links to click for easy access. Many of these actually came from you all through our discussions in previous sessions, and none of these tools are required. They're just suggestions for tools that may be helpful, just sharing some information here so everyone has access. These tools can help individuals in recovery by identifying their career interests, such as the ONET Interest Profiler and the Holland Code Test links up there. Exploring career paths can be done through the Roadmap Nation link. Assessing academic skills for workforce readiness can be done through the TAB test link. Additionally, Prepare and the AHC screening tool, those links down at the bottom, they can help to evaluate social and health-related needs that could impact employment. These or similar assessments can be valuable in guiding individuals toward meaningful and sustainable career opportunities. The next strategy for connecting clients to employment services is to incorporate the needed services into individual care plans. Staff responsible should integrate the identified services into each client's care plan to ensure that support provided is tailored to their unique needs and circumstances. Care plans serve as essential tools in offering personalized support, particularly during the transition from substance use disorder recovery to employment. These plans act as a roadmap that outline the specific services, goals, and strategies necessary for a client's recovery and employment journey. Developed collaboratively with the client, rehabilitation counselors, and other service providers, a care plan should be dynamic and adaptable, reflecting the client's evolving needs and progress. By customizing care plans to include services such as job placement, on the job supports, maintenance services, and job search assistance, care managers can more effectively address each client's unique challenges. This individualized approach ensures clients receive the most relevant and effective support, enhancing their chances for long term success in the workforce. The next strategy for connecting clients to employment services is continuous evaluation. I mentioned that care plans should be dynamic. It's essential to regularly assess the effectiveness of services being provided to ensure they remain relevant and impactful. By continuously evaluating the progress of clients and the outcomes of the services offered, care managers can identify any gaps or areas for improvement. This process allows for necessary adjustments to be made, ensuring that the support clients receive is always aligned with their evolving needs. Regular evaluation also helps refine strategies, improve service delivery, and increase the likelihood of clients successfully achieving their employment goals. The next strategy we'll discuss for connecting clients in SUD recovery to employment services is utilizing vocational rehabilitation programs. So, as you guys mentioned in the chat earlier, these state and federal programs offer a range of services designed to support individuals with SUD, increasing their chances of achieving successful employment outcomes. Some services they provide can include job training, resume building, interview preparation, and ongoing support to help individuals succeed in the workforce. These programs can provide essential support that increases the likelihood of successful employment outcomes. PA CareerLink will actually be presenting our next session on March 26th. It's important to involve vocational assistance in the care management and aftercare planning process from the very beginning. By including vocational support early on, clients can better understand the range of vocational services available to them and how these services can complement their recovery journey. This proactive approach helps ensure that clients are aware of the supports that can play a role in their transition from treatment to aftercare. This early involvement also fosters smoother transitions into aftercare by addressing any barriers to employment and ensuring that clients are prepared to maintain and sustain their employment goals. Care management staff should be well informed about the range of vocational services available to clients. Often, care managers may not fully understand the benefits and resources that vocational support offers, resulting in missed opportunities to enhance client outcomes. So, providing training sessions or informational workshops can effectively bridge this knowledge gap, ensuring that care managers are equipped to connect clients with these valuable services. This fact was actually the motivation for this training series. And our next two trainings in the series will focus on educating care managers about the vocational services that are available here in Pennsylvania. So, one of the key strategies for connecting clients with SUD to employment services that we'll focus on today is the development of effective partnerships. Establishing strong collaborations with local businesses, vocational training centers, employment agencies, and community organizations is crucial for creating a supportive network tailored to the unique needs of clients. So now I'm tossing it out to you all. What effective strategies have you used to develop partnerships with employers or employment services? So, how are you building these partnerships with potential employers? And again, you can put in the chat or you can raise your hand if you would like to be unmuted. I'm seeing in the chat networking events with employers and small business owners, hosting actual hiring events, outreach and sharing personal stories is so beneficial. That's so true, Patty. So making it tangible for people when you share stories. Networking through hiring events and career fairs, monthly networking, job fairs. Mhm. Collaborating with colleges and their career services departments, tabling events as a job matcher, inviting businesses and community resources to come to your facility, to come and make that connection in person, get to know you all, put some faces and names to the organization. Our job developers outreach to local employers who come in to present and attend job events. Visit treatment facilities to provide services as a veteran employment rep, and then educate the staff and clients for warm handoffs when clients are ready to leave treatment. They also help them to overcome barriers before they leave treatment. So, again, love that, Sunshine. So, using that proactive approach. Completing a detailed profile with newly registered employers to learn about the business. Yes. Attending networking events and participating in other organizations' sponsored events. Yep. So showing up for other people the way you'd want them to show up for you, right? That's so important. Networking with temp agencies and getting contact information for the specific job recruiter. Yes, and that's so important to get that contact information for sure. Wonderful. Taking tours of the businesses to understand their needs. Yes, you guys have some great ideas. So, successful partnerships in social service organizations require a well defined strategy and shared objectives to ensure their effectiveness. A clear strategy helps establish a roadmap for each partner's role, expectations, and contributions, fostering alignment from the outset. By defining shared goals, all partners can work cohesively towards a common vision, minimizing misunderstandings or the duplication of efforts. This alignment ensures that each organization's strengths are utilized to address the complex needs of the clients they serve. When all partners are on the same page, resources can be pooled more efficiently and support systems are more robust, leading to improved outcomes for the communities being served. Effective collaboration hinges not only on having a shared purpose, but also on establishing transparent communication, regular check ins, as you guys stated. So, having regular scheduled meetings where you're touching base, and a commitment to mutual accountability. These foundational elements create an environment where all partners can contribute meaningfully. Establishing partnerships with government, nonprofit, and for profit organizations is paramount, as each offers unique resources and support. Research shows that collaborations with government and nonprofit entities are especially beneficial, positively impacting the social performance and social enterprises by helping to leverage essential resources for their social initiatives. Additionally, involving stakeholders who possess the necessary skills, resources, and legitimacy ensures that each partner can contribute effectively, enhancing the overall success of the partnership. When identifying potential partners, it's important to recognize the specific barriers that individuals in recovery frequently encounter. These barriers, such as stigma associated with substance use disorder, legal issues, and limited access to transportation require a collaborative approach to create lasting solutions. By partnering with legal aid organizations, recovery-focused transportation services, and advocacy groups, programs can build a network of support that directly addresses these challenges. For instance, legal aid organizations can provide assistance by expunging records or navigating legal obstacles that hinder employment. Collaboration with transportation providers can ensure that individuals have reliable access to treatment, employment, and other essential services. It's also important to assess your own organization before entering into a partnership. This can help ensure that both parties can work effectively together. This evaluation allows you to identify your strengths, weaknesses, and available resources, which in turn helps in finding a compatible partner whose goals and values align with yours. A thorough self-assessment not only enhances your ability to contribute meaningfully, but it also lays the groundwork for successful and mutually beneficial collaboration. So now we'll move on to some practical application today in regards to developing these partnerships. Some of you have already shared organizations, employers that you have developed partnerships with. And we're going to do an exercise now where I want you to think of your own organization. And then I want you to think of a local employer. Have someone in mind. Who's someone in your local community that can employ people? So, who might be open to a partnership with your organization? And then I'm going to ask you some questions, and I want you to kind of think about how you would build that partnership with them. Throughout these questions, I'll use an example of a care management provider that's seeking to partner with a local welding shop, okay? As we go through this, please feel free to raise your hand if you want to share out loud, and I can unmute you, or you can continue to put your answer in the chat. I see some people putting their answers in the chat of who they're envisioning. Good, good, good. And I heard Gina say, this is so important. Yes, 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 for underserved communities is so true. All right, so here's the first question. Thinking about your organization and then thinking about the partner organization, what are the primary objectives each partner might seek to accomplish through this partnership? Because those primary objectives might be different. What are the primary objectives? So in my example, for instance, with the care management provider, the objectives might be for them to strengthen relationships with local businesses and reduce stigma to create supportive working environments. For the welding shop that I would be looking to partner with, they might want access to a reliable and motivated workforce. So their aim might be to fill labor shortages and recruit those in recovery to make their pool of prospective employees larger. So they're seeking support for their community initiatives and enhancing their reputation as a recovery-friendly employer. So in the chat, I see some people saying that some organizations want to have qualified candidates. Others might be seeking to identify qualified applicants with the necessary skill levels. For Elizabeth, their objective for her organization would be to obtain employment for our participants. Straight to the point, right? Trying to get them employed. Um, for Keylink and Superior through the Aerotech agency. Okay, so that might be your actual like envisioning who you're partnering with. Providing opportunities to local residents. For the employer, they're looking for qualified and dedicated employees. Yes, that dedication piece is definitely important. That's what people might be looking for. All right, the next question. What measurable outcomes might indicate the success of this collaboration for both parties? So how would you measure the outcomes of success? How do you know that this is working? So for my example, it might be helpful to measure the number of clients that secure full-time employment. So if my goal is to get clients employed, I might want to know how many clients did we secure full-time employment for. So I see in the chat, people getting and keeping jobs for several months. Was the expectation of the employer and the job seeker both met? Yeah, so seeing if people actually got what they wanted out of going into the partnership, the number of successful hires, if the clients are able to maintain employment. So looking at longevity and length of time they're able to maintain employment. Mm-hmm. Other thoughts? The number of people that maintain their recovery. Land employment, the number of people who are able to land employment, and then retention. Individuals who meet a 90-day probationary period. So are they able to meet that initial probationary period where they're connected and then engaged? Some other examples might be the number of clients who gain industry certifications or some sort of new technical skill. As someone pointed out in the chat, if your goal is around recovery, right? If you're a social service organization that's working with the individuals in recovery, you might want to look at the reduction in rates of return to use among the clients participating in the program and the number of additional employers expressing interest in similar partnerships, right? So that might be a measurable outcome. If like you secure one partnership, how many more can you secure to know that you're doing this? All right, next question. Great participation, guys. I appreciate it. Um, what specific skills, expertise, or resources does each partner have to contribute to this collaboration? So going back to my example with a care management provider and a welding shop, the care management provider in my example would need to be able to provide case management, right? They need to be able to provide support services to ensure that clients are stable and prepared to work. And the welding shop would want to provide hands-on training in a skilled trade, so a real-world application of a skill that that individual could use. So what are some specific skills or expertise that each partner would want to provide? So Eileen put in the chat follow-up, right? If you're a social service agency or a care management agency, people are going to expect you to be good at following up and checking in. Absolutely. What are some other skills or expertise that you bring to the table or that you would expect the partner to bring to the table? Communicating, yeah, for sure. Follow up, second on that one, being able to follow up. Soft skills training, yes. So people might expect you to help people develop those soft skills. Both partners should be able to communicate, right? People would be expecting communication. Mhm. Any other skills or expertise, resources? Connections to other resources to overcome other barriers than employment. That is so important. I think that they would be expecting, right? As we mentioned, it would be multifaceted for individuals with substance use disorder. There might be other things when you're looking at social determinants of health, when you're just looking at a multifaceted person, we're all going to have more needs than employment. So if you're a care management or a social service agency, people are going to expect you to have expertise on helping people overcome their barriers, for sure. Computer literacy skills, I love that. Yes. In the age that we're in with technology, somebody's going to need to know how to train people, as you guys had mentioned, in things like LinkedIn, how to leverage social media, all of those pieces, the basic computer literacy, sending emails, setting alarms and timers, and how a lot of that has changed, especially when you're thinking about folks post incarceration, right? The employer providing mentorship on the job. We provide budgeting services to make sure clients are living within their means and can continue on with their new job. Love that. So, budgeting, financial literacy, connection to resources that you know the resources and you're able to connect people to them. Maintaining contact with case management for a period or remaining in counseling. So, helping clients develop some skills that the company needs. Love it. You guys are coming up with great stuff. Resume writing and assist with gaining references. So then the next question, how could responsibilities be divided to leverage each partner's strengths effectively? So if you're both coming in with different strengths, how do you divide it up? So we see outreach to sell your skills, like how to sell your skills as a specific resource or expertise. Yes, that's a really good one. So how could the responsibilities be divided to leverage each partner's strengths effectively? So for my example, the care management provider could facilitate regular check-ins with both the welding shop and the interns, the people that they're placing there to get employed. And that's showing proactively that you're looking to address any concerns or challenges. For the welding shop, they could assign experienced staff to mentor or supervise the new employees, ensuring that they are receiving that quality instruction. And I thought I saw something in the chat about AI. Um, Evaluating one's transferable skills with regards to the needs of the employer. So evaluating, like self-evaluation. Proper training and advertisement on our end and the availability on the employer's end. How to assist with getting ID, birth certificates, and social security cards. It could be really important to have those discussions about how responsibilities would be divided up. Yeah, so true. Yeah, and I think that's the crux of this question, right? That's something that you don't think about, or you might not think about going in of like, this is what we can do, this is what they can do, but how are you defining that operationally, and how are you following up on that? hmm And who's doing what, basically. Collaborate to have on-site events, share success stories, and motivate others. Yes. So like a touch base where you're kind of celebrating the progress. All right. So next question. What potential challenges or conflicts might emerge during this partnership? So keep in mind your organization and keep in mind the partner organization that you're thinking. What could you see as some potential challenges that might arise? So for my example, the welding shop might have concerns about safety risks, right? It's a welding shop. There might be concerns about liability when working with individuals in recovery. And then in response to earlier when we were talking about resources, um, it was put in the chat that many people might not know that individuals with opioid use disorder can get a free birth certificate in PA. So that's something to look into that people are discussing in the chat. But back to the question of potential challenges, what might you envision would be a challenge, right? Lack of resources in the area and transportation barriers. A lack of communication between partnerships. Yes. So how we're trained to communicate in social service versus in the private sector versus for businesses versus for a welding shop and how they're trained to communicate might be completely different. So that is a really, really good point. The employer might not be on public transportation routes. Yes. So if your go-to way to help people navigate transportation challenges is connecting them to public transportation, the employer that you're connecting with might not be on the transportation route. So that's something to think through as you're making partnerships, or how are people going to get there? Flexible scheduling, so those with SUD can attend their treatment. Yes, because that may be problematic. Yes, that is such an important piece. When you're thinking about whole person health and we're encouraging them to get connected with all of these services, that means a bunch of appointments, right? So are they able to do those things that they need to do to take care of themselves? Changes in leadership. Yes, yes. Clients might not show up to the job. He or she might not wake up on time for the bus if they're still using public transportation. Mhm. There might be a lack of proper supervision, right? So you have all these lofty goals and things that you want this partner to do, but someone supervising day to day and ensuring that that's happening might not occur. Great answers. Thank you, y'all. All right. And last question. How might differences in organizational culture or operational practices be reconciled? So, as we mentioned earlier with the challenges, I just wanted to give some more examples. Clients might need additional training or support to meet the workplace expectations or skill requirements, and that just might be a reality of the situation. Another reality might be stigma or bias, right? So people might say on paper, I have this initiative, I want to get connected with people. However, there might be a reality of stigma and bias when people actually show up to work there. Communication breakdowns, as you guys mentioned, and some clients may struggle with attendance and punctuality, as you also mentioned. So, differences in culture might look like, in our example, regular meetings might resolve those differences between the care management place and the welding shop. So if you're regularly meeting, you can establish clear expectations, and when the realities of challenges arise, you can address them proactively. So some other um, ways to reconcile might be gaining a mutual understanding of each other's cultures to identify the quality of clients. Yes, yes, yes. So sharing with each other who you are, what your values, what your missions are. Focus on shared values with partners. Trauma-informed training with the employer. Oh, that's so important. So providing evidence-based training that we might have in the social services arena to folks who are working in the private or nonprofit area on things like trauma-informed perspectives of how to work with people. Mhm. And that speaks to cross training. Yeah. So providing cross training where you can share information, having a structured onboarding process can help align expectations. Very good. So thank you guys for your participation. So one way to leverage these partnerships is a model called Individual Placement Support, IPS, which integrates community resources to provide personalized, comprehensive employment support for individuals with substance use disorders. We decided to highlight this model in training because IPS is a proven model that highlights the power of collaboration in supporting individuals with substance use disorders. By integrating community resources, IPS ensures that employment support is not just about placement, but also about long term success through personalized services. Understanding this model helps organizations and providers see how strategic partnerships can improve outcomes and create more sustainable recovery. IPS is an evidence based practice initially designed to assist individuals with mental health conditions in securing and maintaining employment. The approach focuses on providing personalized support to facilitate job placement in competitive work environments, ensuring that roles align with an individual's strengths, preferences, and needs. While IPS was originally developed for those with severe mental health conditions, recent studies have explored its effectiveness for individuals with SUD, substance use disorders. Research has shown strong evidence supporting the application of IPS for individuals with SUD, both independently and in conjunction with mental health disorders. A systematic review highlights that IPS helps individuals with SUD secure and maintain employment, contributing to better recovery outcomes. By integrating IPS into SUD care management, individuals gain financial independence and access to meaningful employment, which can reduce the risk of return to use and support long-term recovery. The key components of IPS include several principles designed to maximize success for individuals with mental health or substance use disorder. First is the zero exclusion principle, and it ensures that everyone, regardless of their level of impairment or history of substance use, is eligible for employment support. No individual is excluded based on their health status or past experiences with substance use. Rapid competitive job search is another core element. It encourages individuals to quickly transition into the job market by finding positions that align with their skills and interests without the lengthy pre-employment training. IPS also integrates with care management, offering employment support as part of comprehensive recovery approach, addressing both health and employment needs simultaneously. So that's kind of what you guys were speaking to of thinking about appointments and flexibility in terms of scheduling. Finally, the program emphasizes the focus on benefits, recognizing the broader advantages of employment, such as improved self-esteem, social inclusion, and financial independence, all of which contribute to long-term recovery. IPS helps individuals secure and maintain competitive employment, which supports their recovery and enhances overall well-being. By offering personalized, job-specific support tailored to their strengths and preferences, it is effective for those with SUD. Employment through IPS leads to financial independence, social inclusion, and improved self-esteem. Additionally, it integrates well with other treatment services, providing a holistic approach to recovery. So we wanted to talk about some resources that may be helpful as you support those in recovery to find employment, particularly when working with partners. All of the resources that we share in this section will be linked in the presentation. When you receive the slides, you can just click on the link. People in recovery are one of the most effective tools for combating stigma among employers. By sharing their personal stories, they humanize the challenges of those and they challenge those narratives and help employers look beyond the stigma, recognizing the resilience and potential of individuals in recovery. Encouraging people in recovery to tell their stories fosters empathy and understanding, breaking down misconceptions and promoting a more inclusive and supportive workplace culture. This approach not only educates employers, but also empowers those in recovery, highlighting the value of their experiences and contributions to a diverse workforce. Another valuable resource to consider as you explore ways to support individuals with SUD is the Evidence-Based Resource Guide series, Substance Use Disorders Recovery with a focus on employment and education. This guide synthesizes scientific literature, best practices, and peer-reviewed models, while also addressing challenges and gaps in their implementation. SAMHSA emphasizes the importance of supporting long-term recovery through employment opportunities, and the guide acknowledges the varied experiences of individuals in treatment and recovery. This evidence-based resource guide series was developed with input from expert panels, including federal and state representatives, as well as individuals with lived experience. This guide stresses that the implementation of evidence-based practices requires a holistic approach and encourages users to explore additional tools and technical assistance on the SAMHSA website to support the integration of evidence-based practices into service delivery. One tool social services agencies can use is the Recovery Ready Workplace Toolkit, guidance and resources for private and public sector employers. The RRW Toolkit is designed to assist employers in creating supportive environments for employees affected by substance use. And then I did see a question about links. The links will be linked on the slides, which will be sent to you. If you put your email in the chat, we'll send you all of this, and all of the slides have the links on them. So this toolkit includes a flexible framework that can be tailored to diverse workplaces, ensuring that RRW initiatives meet specific organizational needs. Additionally, it serves as a resource for various stakeholders, including employers, states, local governments, labor organizations, business groups, and nonprofits, making its guidance broadly applicable. A primary focus of the toolkit is to help businesses prevent and respond effectively to substance misuse, promoting the hiring of individuals in recovery and fostering a recovery supportive workplace culture. The toolkit also connects users to the RRW Resource Hub, offering a wide range of additional resources beyond the toolkit itself. Designed for continuous improvement, the toolkit plans to evolve by incorporating new materials and industry-specific guidance to remain relevant. In essence, the toolkit helps employers create recovery-supportive workplaces with practical guidance, adaptability, and comprehensive resources. The Pennsylvania Department of Labor and Industry has developed a pamphlet entitled Resources for Employers Supporting Individuals with Substance Use Disorder. This publication has resources in it that could be used to help educate workforce partners about the state resources that are available to help them support those in recovery, including the PA Workforce Education Initiative by DDAP, the Department of Drug and Alcohol Programs, which supports employers in addressing substance use in the workplace. DHS also promotes community health assessments, healthy behaviors, and harm reduction strategies, such as naloxone distribution. This could be shared with employers you partner with to enhance their knowledge. And so our last question for the day, are there any resources that we might have missed? Are there any resources that you want to put in the chat or unmute to share about that you have found helpful? So we want to hear about those resources if you have them, so we can share them out with everyone. And with that being said, if there are any questions, I don't know how much time we have, but we are at time. But if you want to, if there's anything pressing, feel free to put it in the chat. And then in the session chat, there is a link to the evaluation for you to claim continuing education credits if that's needed. So be sure to look at that in the chat. There's a link there to do the session evaluation and gain those credits. We see people sharing about articles and infographics on LinkedIn. Yes, that can help with interview skills. Rabbit Public Transport provides free bus passes in their area. And Wanda, if you could put in the chat what your area is, that's wonderful. And again, if you haven't put your email address in the chat, please do so before you go so you can be sure to receive these resources. And then yes, Wanda, so you're in York. So that's a resource that's in York. Thank you for sharing that. Thank you guys for putting your emails in the chat. Thank you so much for joining us. We hope that you found this beneficial, and we will see you at the next session.
I just want to thank you, Christine, for presenting our session today. I want to thank everyone who attended. I want to remind you that our next session is on March 26th. Everyone who attended this session, everyone who registered on Eventbrite will get a reminder about that session, and we'll send that out. But thank you, Christine, and have a great day all.